It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Catafamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Welcome to Countywide. I'm Paul David. As always, it is great to have you in studio with us today. A couple weeks ago, Sue Thu from Vitalant sent me an email that says there's a critical blood shortage in the state. And Sue Thu is in studio with us today. Just like that, poof, here you are. How are you?
I'm doing great, and I really appreciate the opportunity to talk about how important it is for people to donate blood right now.
I appreciate you driving all the way from Phoenix this morning to be here with us this morning.
Well, it was a beautiful day to do a drive up the hill.
It is a nice drive.
Yes.
It is a nice drive. Okay, so a couple weeks ago, it was, I think we hit the new year, and one of the first emails I got from you was, we've got a critical blood shortage. So where do we stand with that? Give us an update.
Well, we've made some progress, but you know, we've just come off of the most difficult 2 weeks of the year to maintain our state's blood supply, and that's followed by the highest blood usage month of the year because people postpone surgeries until after the holidays when they're non-emergency surgeries. And so it's going to take quite some time to build levels up to normal levels. We strive to keep about a 3 to 4 day blood supply on the shelves of all blood types. Right now we're at about a 2-day blood supply for O negative, the universal donor, and about a 1.5 day supply of O positive, which is the blood type that can be substituted for all the positive blood types. So we've still got a lot of work to do, but you know, fortunately we're making some progress.
How much blood do you need in the hospital per day? Just, can you give us an idea on that?
Well, Arizona, we serve the needs of 62 hospitals here in Arizona. That's 90% of the state. And to keep up with that demand, we need to bring in about 600 blood donors every single day. And, you know, that's a huge task, and that's the reason it's taking us some time to get blood supplies up to normal levels, because while we've had more people coming out to donate blood, you know, blood's going out the door very quickly as well. So it's important that people make it a priority to donate. You know, we're up in this area, in the Verde Valley area, Flagstaff, Prescott, all of those communities. Every single week we're somewhere within those communities, and so it's important for people to try to find a location in their community and donate blood.
Wow. And it doesn't take long to do it. It's like 15, 20 minutes, 30 minutes maybe tops,
well,
or up to an hour maybe.
The actual donation is just 5 to 10 minutes, but the process, it takes about 45 minutes to an hour. And that's because there's lots of benefits for the donor when they give blood. You start off with a free mini physical, so it's a great way to find out about your pulse, blood pressure, temperature, blood iron level reading, that sort of thing. Then they need to ask a few questions about your health history, and then you move on to the donation area where they take just a pint of blood from the crook of your arm right here, which is just a tiny pinch, no worse than getting your annual flu shot.
Never.
Yeah, 5 to 10 minutes later, you're finished. You relax in the canteen, have some refreshments. We want you to rehydrate and have a snack to make sure you're feeling great before you walk out the door and pretty much resume most of your normal activities.
And then how long do I have to wait before I can do that again, Sue?
Well, you can give blood every 8 weeks. So
okay, every 2 months.
That's right, and that's why you see a lot of blood drives in the communities here, like on a quarterly basis, because that ensures that people have enough time between their blood donations so that they can give 3 to 4 times per year.
Okay. Now, you mentioned a lot of people, and that makes sense, and I'd never thought of that before, and this is the first time I've heard you mention it too, to me, or maybe I just never noticed it before, that people will postpone surgeries because of Thanksgiving, Christmas, New Year, holidays. So if I don't have to have a surgery in November, December, then why not wait until January and do it then? So that is one of the reasons why we run it short in January.
Absolutely, you know, and when we say non-emergency, it doesn't mean that it's not an important surgery. If you need to have a hip replacement, you need to have a hip replacement. But who wants to schedule that during the Christmas holiday week? You know, people want to spend the holidays with their families, and then it's back to, you know, normal activities as soon as the holidays are over. And, you know, stop and think about the people who did have to spend their holidays in the hospitals. hospitals using blood transfusions and at a time when blood donations are so low. And, you know, in January, we get hit with our highest population time of the year. We've got beautiful climates here. People want to come to this area during the winter. And so not only do we have people who've postponed surgeries, but it's when our population is at the highest, which means there's probably the patient population is at the highest as well.
And we got more donors as well, don't we? And that's why Vitalant changed to Vitalant last year from United Blood Services. Or was it year before last?
Well, we used to be known as United Blood Services.
Right.
And what most people don't realize is we were actually founded and are nationally headquartered right here in Arizona. We were founded in 1943. And over the course of the last several years, there are a number of different blood centers across the country that joined our organization. And while they were part of the United Blood Services family, they had different names. So as people travel around the country, nobody knew that United Blood Services was the same thing as all these other blood centers. And we wanted people to know that whether you're on the East Coast or your West Coast, your blood provider of choice is Vitalant. And that's why everybody changed over to one new name, pronounced Vitalant, so that people would know who their blood bank was as they traveled across the country. Our organization serves about 1,000 hospitals across 40 states. So we are the nation's second largest blood provider.
Oh wow, second largest. That's a big job.
It is a big job.
But it makes sense why you switched to Vitalant, so everybody can, whether you're from New York or whatever, you come to Arizona, you see that there's a blood shortage. It's critical at that stage as well. You could just go anywhere. And Vitalant, by switching all to the one name, yeah, people say, oh, I know what Vitalant is. I know what Vitalant is.
Absolutely.
It'll probably take a little bit of time for that to catch on, but eventually it will. And then no matter where you are in the country, you can walk in and get blood.
Absolutely.
Yeah.
And it gives us the opportunity to combine our resources, have the same website, have everything so that people go one place to, you know, make their blood donation appointments, as well as to find out about, you know, different transfusion needs through their doctor. So it was an important change that we needed to make that, you know, has taken some time to get the word out so that people know that United Blood Services didn't go away. We're still the same people with the same mission. We just have a new name.
Mm-hmm. Yeah, exactly. And then we talked on the phone. I did a story with you for Friday, Saturday, and then we ran it yesterday as well because I knew you were going to be in here today, so we'd get even more information out about this. It's not just people pushing off surgeries in the month of January. I mean, we're right in the middle of our flu season.
Absolutely.
That slows it down. So if I had the flu, it's probably, can I give blood if I have the flu?
You need to be 100% symptom-free, because what ends up happening whenever you get sick with a cold or flu, your body is building antibodies in its blood to, you know, help you get better. So if we take your blood when you're sick, then, you know, we are running the risk of you know, interfering with your immune system. So that's why it's important that people are healthy when they donate blood. In fact, we're not allowed to take their blood if someone's currently suffering from a cold or a flu. Those are things considered active diseases or active infections, prevent you from donating blood. But lots of things don't prevent you from donating blood. A lot of people think just because you're taking a certain medication that you can't donate. But, you know, news is most maintenance doses of medications are absolutely fine. So if you take things like birth control pills, vitamins, hormone, thyroid medication, high blood pressure medication, antidepressants, painkillers, all of those things are fine because they're just considered maintenance doses. But if you're taking antibiotics because you have the flu, or you're taking blood thinners because you have heart disease, we don't want to risk imbalancing your medication or taking your blood when you're sick. So those are the types of things that will prevent you from donating blood.
Wow, there's a lot in there, huh?
There is.
But not much will stop you from donating blood. That's what you did make a point of right there. There's a lot of reasons why you should be able to donate
absolutely.
blood. Yeah.
And you know, I try really hard when I'm talking with the media to make sure that I don't give so much information that people will make the decision that, oh, I can't give blood, because so many times it's just you need to have a conversation with a donor care technician to find out about your particular situation. And you know, it would be really sad for somebody to not volunteer just because because they thought incorrectly they weren't eligible to donate blood when, maybe they can. And it makes you feel great to donate because you're helping somebody out in such a special way.
Yeah. We have to take a break, okay? Vitalant Sue Thu is in studio today. The website you're looking for is bloodhero.com. If you go there, you can type in, I believe it's your zip code, your address, and it'll take you right to where blood drives are closest to you. That's bloodhero.com. This is Countywide. We'll be back in just a couple minutes.
Start your journey toward better health with Ageless Touches Massage Therapy. Licensed massage therapist Richard Stevens uses the latest and best equipment to relieve scar tissue, electronic smog, and tinnitus. Ageless Touches does everything they can to work your issues down to the bone. Improve your path to better health with Ageless Touches Massage.
Award-winning Soundbites Grill is an entertainment restaurant located in Uptown Sedona at the Hyatt Pinion Point Resort. Open for lunch and dinner, featuring fresh fish, all-natural hand-cut beef, even a full vegan menu. Family-friendly, open 11:30 to 9, late dining on Friday and Saturday. Soundbites Grill has some of the best views of the Sedona Red Rocks. Offers world-class entertainment, food, fun, and music.
Two things we can count on every year:
a new set of tax rules and great weather here in northern Arizona.
Jackson Hewitt Tax Service, locally owned and operated by Lewis Rice since 1997, is here for you all year long.
Your neighborhood Jackson Hewitt Tax Office will help you in all of your taxing situations.
Electronic filing is always free with your tax preparation at Jackson Hewitt Tax Service.
Get more in return. Call 1-800-234-1040 for an office near you.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. But it's always the same basket, and it's always in the same place. And then she acts so surprised when I find them, but, she's putting them in the same basket. Again. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
Welcome back to Countywide. We're sitting down with Vitalant Sue Thu. Bloodhero.com is the website, bloodhero.com, to make an appointment for a blood drive. Appointments are the best way to do it. I mean, you can walk in, but it's nice to have an appointment. It just makes things move a little bit quicker for you as well.
It helps us be a little bit more efficient.
Sure.
If donors come in on according to how we can process them.
Mm-hmm.
So, and it helps you get through more quickly.
Yeah.
And then, it never hurts to know how much blood to expect.
Yeah, but walk-ins, I think you'll take walk-ins though too, won't you? Yeah.
We certainly will.
Sure, yeah. You're not going to turn away a pint of blood.
Absolutely.
Yeah, okay. All right, some stories. I think people don't realize just how much blood actually is used in a hospital per day, but you've got a couple of stories you'd like to share of just
I do.
How much.
So, blood helps a number of different kinds of patients, because it's separated into components. So red cells go to help people who've had surgeries or accidents. Plasma controls internal bleeding, and platelets are used by cancer and leukemia patients. But the story that comes to my mind right now is a little boy that we worked with yesterday. We actually had our all-staff meeting yesterday for Vitalant, and this family came and shared their story with all of the people who recruit blood donors for a living. And Nathan is a 5-year-old little boy. He lives in Casa Grande, and he was diagnosed with a really rare blood disorder when he was about 3 months old. Born a healthy baby boy, but became severely anemic at 3 months old. And it turns out that while most people's red blood cells last for 30 days, for Nathan, his red blood cells only last 7 days. So he has to go to the hospital every 3 weeks and receive his blood. Otherwise, he will not live. And he received his 79th blood transfusion on January 8th. And this is something that is his prognosis for the rest of his life. And you never know. It's not just people who get into car accidents or elderly people who go in to have surgery, or heart patients, or, there's so many different kinds of patients. Since I've worked for Vitalant over 30 years, I've had 3 of my immediate family members, both of my parents as well as my brother, had to have emergency transfusions. My mom fell and hit her head and received plasma when they were trying to stop the bleeding for her brain bleed. My dad had bypass surgery on Christmas Eve and required all 3 blood components, red cells, platelets, and plasma, and spent 30 days in intensive care receiving blood transfusions. And my brother had a hemorrhage and received more than 24 transfusions while they were trying to save his life. And, you know, every day I'm reminded of people who are alive today because of people like you and me who give blood. And, you know, it isn't just something I preach. I gave blood on January 5th, and I try to give blood 2 or 3 times a year just to always make sure it's there, because you never know when an emergency is going to happen.
Can you imagine going to a hospital and you need a transfusion and they said, sorry, we can't do it, we're out?
And
how strange would that be?
That has happened for people. I've met patients over the years. Sometimes patients have to be matched by much more than just blood type, or maybe it's a real perishable component like the platelets in your blood that only last 5 days once they're donated. And I've had people who have shared their stories for us that have been told that they had to wait a day before the blood could be made available for them to receive their treatment. And so it's not that far-fetched. And so this time of year, it's just so important that people take the time to get our blood supply replenished again, because we are at our lowest time of the year. And there's just no excuse for not having that when we've got we're the fastest growing state in the country. There's no excuse for not being able to get 600 people a day to donate blood across Arizona.
Wow, that's a lot of people. I think of that, and I think, oh, that's an astounding number, 600 people
it's
a day.
It's a lot of people.
But you do it most days, don't you?
We do. And but this time of year, we're trying to do catch-up. So we need more than 600 people a day to donate blood right now until we can get our blood supplies back up to good levels again.
You guys usually send out a little story sometimes with your press releases, stories that go along with donating blood, which is nice. So
I always try to do that because I think, you know, sometimes people will donate because they hear of an extraordinary need. Sometimes people will donate because they hear the story of somebody right here in our community who's needed blood. Sometimes they donate because they hear they're going to get thanked with a pizza or something special from a local sponsor.
Right.
You know, it's just important that whatever motivates you to donate, you know, we try to put that out there for people so that they feel good about what they're doing.
And again, like you said, it doesn't take long to do it. It's an hour of your day. Let's jump into something else real quick. If I have a business, and we've talked about this with you before on the show, if I have a business and I have enough space, how would I go about getting a blood drive, to sponsor a blood drive at my business?
Oh, it's really easy. Just contact us and let us know. And if you go to the Vitalant website, and our name is spelled V like in Victor, I-T-A-L-A-N-T, vitalant.org. There's a little place on the website there that it just says Contact Vitalant. In fact, I manage that website. So if somebody sends an email into Vitalant saying, I'm interested in hosting a blood drive, I'm the person who gets that email, and I'll make sure that somebody gets in touch with them right away to talk to them about the possibility of organizing something. We do need to have a minimum number of people that, you know, want to come together on the same day to donate. So generally speaking, we need to have at least a group of 20 people interested to donate, and we'll come to you to make it really simple and convenient for people to give blood.
Oh, so basically if I have a business and I got 20 employees, I'm set. I can have you guys come and do that. But I go on the list of the bloodhero.org website and say, so anybody would come in. Anybody could come in as long as they have an appointment.
So you go to vitalant.org.
Right.
Let us know that you want to host a blood drive, and we need 20 people who want to donate blood. Generally, it would take a group of maybe 100 people to have 20 actual blood donors, because not everybody can donate blood. Generally speaking, about a third to 50% of the people out there probably can donate blood. They're in the right age group. They're healthy right now. They're willing to donate, that sort of thing. So just, you know, get in touch with us. We'll work with you. We'll make it really easy. We supply all of the posters and marketing materials that make it easy for you to publicize your blood drive. And if you're not big enough to have a blood drive, just go into bloodhero.com, put in your zip code, and find a community blood drive right here. We do blood drives in most of the hospitals around Arizona, as well as many of the businesses. The high schools are generally great sponsors, as well as the colleges. Those are probably the three biggest groups in the outlying communities that host blood drives on a regular basis.
Yeah, I know Arminga Senior High School does a great job with their blood drives. I know they have
sure
since I was going there.
They're an award-winning high school.
Yes.
They do so well.
Yes, they are. Vitalant's Sue Thu is in studio today. That website again is bloodhero.com. Countywide will be back in just a couple minutes.
Feng Shui artistry, the oldest form of development planning, today known as the art of placement. For 26 years, master Feng Shui educator, practitioner, artist, and author Caroline Patrick Bournet has used ancient rules of environmental, physical, and spiritual harmony to support clients' health, knowledge, creativity, and success. In mapping your home, you'll understand yourself. Better living is the gift of a lifetime. Change your life one room at a time. Schedule your Home Therapy 101 consultation today.
Show your customers how much they matter to you. Follow up with a real card in just 60 seconds with Send Out Cards. Send Out Cards makes it easy for busy professionals to leave a memorable impression. Stay in touch with a simple one-step process from your phone or computer to their mailbox. Call Judy today at 928-202-2557. That's 928-202-2557.
Been hearing about the crazy benefits of CBD? Find out how CBD can help you at Sedona's #1 resource, CBD Sedona. Come in for a free consultation and let our trained medical staff help you find the perfect product for you. Pain-relieving salves, full-spectrum oils, honeys, teas, cookies, and even CBD for pets. Ready to feel fantastic? Come on by CBD Sedona today.
Metaphysics. What does it mean? It's a branch of philosophy, literally beyond the science of matter. Sedona's University of Metaphysics studies the ultimate nature of existence, reality, and experience. Join 14,000 graduates in over 120 countries, helping others in counseling, coaching, ministry, and much more. The University of Metaphysics is here to serve the best in you so you can serve the best in others. universityofmetaphysics.com.
Welcome back to Countywide. Just a couple minutes left in the program. Real quick, if you're looking for a blood drive that you want to go to, a blood drive that's near you to donate blood, go to bloodhero.com. If you want to find out more about Vitalant, V-I-T-A-L-A-N-T, vitalant.org. You want to go to vitalant.org for information about that. And is that where I would go to contact you about getting my business down as one of the... Okay.
Absolutely. There's a
Okay.
link right on our vitalant.org website where you can say contact us about anything, and so you can write in with a question. It could be an eligibility question. It could be, I want to host a blood drive, anything, and we'll make sure that it gets to the right person to get back with you right away.
Now, you're doing about 600 people a day in blood drives. What would it take today to make it so that we're out of the critical shortage of blood?
Well, I think we just need people to make it a point to keep donating blood for the next couple of weeks at a higher rate than normal. So throughout the month of January, we need to just really focus on having a lot of blood drives, have a lot of people, have all of our appointments filled at all of our blood drives that are going on. And I see in another week or two that we could get blood supplies back up to normal level. That doesn't mean that people can stop donating blood after that, though, because we still need 600 donors a day. So we just need probably 700 or 800 a day right now to try to get us back up to normal levels, and then we can make sure we're meeting just normal demand. You know, blood has a shelf life, so you can't stockpile one time a year to meet the needs of another. The components in blood have a shelf life of 42 days for red blood cells, just 5 days for the platelets in your blood, and plasma can be stored a year. But that's why you don't hear of us having these huge blood drives right before the holidays to get us through, because not all the components could be stocked up like that.
I was going to ask you that because, yeah, why don't we plan ahead? Why don't we, in October, September, October, why don't we plan ahead for January? But you can't. It's not going to last that long anyways.
In September, October,
Makes
we're
sense.
planning for September, October. And, one thing to stop and think about, we talked about having a 1 or a 2-day blood supply of O positive and O negative. Well, it takes 24 to 48 hours to test and process blood before it can even be released to a hospital. So stop and think. When you have a 1 or 2-day blood supply, that means that we are going through the supplies of that blood type faster than we can provide it. And that's why we're on critical appeal for blood right now. O positive and O negative are critical. We need donors of all blood types. We may not be critical on A and B and AB, but that doesn't mean we don't need the normal levels to prevent us from becoming critical on those blood types.
Okay.
So we do need people of all blood types right now, but with a special plea for those type O donors.
All right, Sue, thank you so
Thank
much.
you.
All right, again, bloodhero.com for a blood drive near you, Vitalant.org for more information about Vitalant. That's today's Countywide. Thanks for watching, listening. We'll talk to you again next time.